Hi, I'm Tom Scherbluk from PlantAlchemy.ca, and I'm talking with Sherry Bennet and Sargent Vincent Lefaive, who are organizing the York Region Cannabis Symposium. It will take place on October 10th at the Bayview Golf and Country Club. With legalization of recreational cannabis in Canada happening on October 17th and the continuing growth of medical cannabis use in Canada, this symposium couldn't be more relevant. If you have any questions about cannabis and want to learn more, this is the place to be on October the 10th. Sherry, both you and Vincent are using cannabis for PTSD with great success. How did you first make the decision to use cannabis as a medicine?
Well, for me, Tom, I have a small company that organizes nursing care and personal support care workers. So I had a lot of elder clients ask me, because they had read about it in the news or somebody told them that it was good for arthritis. They asked me to help them get legal access to medical cannabis, and I did. So this was it started about 3 years ago, and these women, they faced a constellation of obstacles, really, to get their medicine, their cannabis medicine. But we ended up getting it for them. They had significant results, and for their arthritis and sleep disruption, etc. And then I was researching it before because I had for over 20 years lived with symptoms of post-trauma. And I was taking all these horrible antidepressants and sleeping pills, and I had huge side effects that were so undesirable. I thought I had to try it myself. And so I delved into the research. I tried it myself. I think my very first licensed producer, I tried oil, the cannabis oil. And then I signed up with actually 5 different licensed producers, and I tried oil and dried flower and capsules. And I found that just in the first week, I would say, I had significant results. No, I would correct that. I would say I would have superior results while taking medical cannabis oil in contrast to the antidepressants and sleeping pills that I was on for 20 years. And I think Ativan too. So we add in a tranquilizer there. And now I take 0 prescription opioid medications or benzodiazepines or SSRIs. I take medical cannabis. That's it. And I find I function better. I personally find that it saved my life because, just so you know, a significant percentage of those of us that have PTSD died by suicide because we can't manage the nightmares and the flashbacks and living in fight or flight mode all the time. It's really a really horrible way to live. So I feel that this cannabis plant has the potential to save lives.
Thanks for sharing that with us, Sherry. Vincent, the years you served as sergeant with the Durham Regional Police Service had a powerful impact on your life. Tell us a bit about how you came to experience the tremendous benefits of cannabis.
My story's long as well, but I think the first thing I'd like to say is that every cannabis patient that I'm meeting, everybody with these medical concerns, everybody I'm meeting has the same message, and that's, gratitude for my healing, right? So, for me, I was a cop for 31 years. I'm still on the payroll. I'm just retiring on Halloween is my official retirement date. Spending it in Haiti, so that's kind of a bizarre way to end it, but the cruise is going to be the best part of my career because, by Halloween, I'll be 2 years fully healed, right? So at the end of, I'm going to say 28 years in, I met a great man, a psychologist who comes and speaks at our retirement seminars, and at the time, his message was just for anybody, first responders who are retiring, there's going to be some maintenance necessary. We're going to need to sort out everything that, you've been immersed in, and, the sights and the sounds and the smells and even the tastes, over the years that represent some real, true trauma. So in meeting this man and deciding that, yes, I absolutely qualify for some treatment, I did enter treatment, and this was in October of 2016, and we discussed the access to the medicine, practically within the first session. He is a huge proponent of CBD, and he's excited for its future as well. So a great many patients in my position are doing the research, we'll say. So, of course, we're all educated people, and we all know the value of evidence, and we all have access to all the best information now. So, from the start, with his recommendation, I did the research, and I read the studies. I followed through with. There's a study at Johns Hopkins University that I read, end to end, and I read the ACMPR, and I read, the College of Physicians and Surgeons guidelines in terms of prescribing and dosage. I did all that research all day long, and I realized that this was for me. I was watching the system failing my colleagues all day long, and we had an officer take his life in our station. Right? And, these things, and, the OPP this summer, they had 3 in the course of a month. And that's not to mention EMS and fire and nurses and, so many people on the front line that are dealing with trauma. Well, humans tend to absorb trauma. And, my statistics, reveal that I lived 800 lifetimes. When you do the math. This is what happens. So the human brain is not set up for that kind of injury. Right? And what cannabis represents for everybody I come in contact with, the experiences, the benefits, what it represents is that opportunity for your brain to heal and your brain to reset. We all need to, we reboot our phones, we reboot our computers. You're rebooting your soul, right? And that's kind of heavy, but, anybody who's experienced a lifetime of trauma knows where I'm coming from, let alone 800 lifetimes, right?
Thanks, Vincent. These are inspiring stories about how each of you overcame the stranglehold that trauma had over your lives, all thanks to cannabis medicine. On October 10th, you can meet Sherry and Vincent and hear from a number of experts in the field of cannabis medicine. Come to the Bayview Golf and Country Club and learn more about how cannabis has helped people suffering with PTSD, and how it has also assisted people in many other ways for pain, anxiety, and overcoming dependencies on opioid medication too. You can get more information at letstalkcannabis.ca and go to the events page. Get your tickets now and join us for a day of information, discussion, and connection as we showcase the tremendous healing benefits that cannabis can have.